Hi, and thank you for joining Telecare's Consultant Corner, a short video on general health inquiries submitted by local Australian GPs, answered by our Telecare physicians.
It's Dr. Cheung, respiratory and sleep physician for Telecare Online. Today I'd like to speak to you about a condition called obstructive sleep apnea, or OSA. This is a condition where people experience a partial or complete blockage of the flow of air through the upper part of the airway and the throat during their sleep. And this can occur many times during the night and disrupts their sleep and reduces the blood oxygen levels. What causes this can happen in people of all ages, but it's more common in men over the age of 65. Obesity leads to greater pressure on the airway due to the fatty tissue on the neck, and is therefore a significant risk factor. However, not all people with sleep apnea are overweight. Some people with anatomical problems, such as enlarged tonsils or adenoids, pulled back jaw, or a family history of obstructive sleep apnea can also develop the disease. Symptoms are related to the repeated obstructions in the airway and the resultant interruptions to sleep. This can include loud snoring to the point where it bothers other people in the household, feeling choking or gasping sensation in your sleep, someone else's noticing pauses in your breathing during sleep, or even waking up frequently to pass urine can be a symptom of OSA. People with sleep apnea often feel groggy or unrefreshed on waking from their sleep, sometimes with a dry mouth or the headache. As the day goes on, they may feel more and more sleepy and with fatigue. Some also experience poor memory and concentration. Now, is it dangerous? Untreated obstructive sleep apnea is associated with high risk of motor vehicle accidents and sometimes workplace accidents due to reduced reaction times as a result of poor quality sleep. Sleep apnea can also lead to cardiovascular disease such as high blood pressure, diabetes, heart attacks, and stroke. Depression and poor memory problems have also been linked to OSA. Now, it's not all doom and gloom. There are tests and treatment available, and an overnight sleep study is the best way to diagnose obstructive sleep apnea. It can be performed at home or as an overnight stay in hospital. We can perform the detailed assessment to see which is most appropriate for you. Now, the management or treatment of sleep apnea does depend on a number of factors, including how severe it is, your personal and medical history and circumstances, and even your usual sleeping position at night can affect what we recommend as treatment. Through a comprehensive medical consultation, we'll determine that. And just to mention some of the strategies, firstly, as obesity has been linked as a risk factor, managing that will be important, as well as sometimes adjusting your sleep position or maybe your sleep routine. Number 2, continuous positive airways pressure, or CPAP, is a mask worn at night to splint the airway open using gentle pressurized air. It may take some time to adjust to this form of therapy, but it works best to relieve the blockages in the throat caused by sleep apnea. Another option is an oral appliance, which is essentially a mouthguard fitted by a dentist with expertise, which can be appropriate for milder forms of sleep apnea. Finally, there are surgical options for sleep apnea, but this is usually reserved for situations where the other treatments have not worked. So that's a brief overview of obstructive sleep apnea. If you enjoyed that.
Thank you for watching. If you would like to submit a question to Telecare's Consultant Corner, please feel free to email us at admin@telecareonline.com.au. Telecare, putting the care into telehealth.